Thank you very much. And next we have Robin Yabroff from the National Cancer Institute.
That's okay. Hi, I'm Robin Yabroff. I used to be at the National Cancer Institute. I'm now with the Office of the Secretary and the Assistant Secretary for Planning and Evaluation, which is the research arm for HHS. So I feel very fortunate to be able to talk about a topic I think is really critical for cancer survivors. It's financial hardship. And I want to also thank the speakers in our panel for really keying up the most important issues related to employment, health insurance, and financial hardship. And these are all interrelated. Okay. So I am going to repeat quickly because some of the things we've already talked about today, in part because I want to emphasize how all of these factors affect each other. So we are seeing an increasing prevalence of cancer survivorship, and cancer survivors, as many have noted, can experience lasting effects of disease and its treatment. And then importantly, compared to individuals without a cancer history, they have an increased risk for other cancers, chronic conditions, healthcare expenditures, including out-of-pocket spending. This is important, greater economic burden, limitations in the amount or kind of work, as Kathy mentioned earlier. And this is really important when you think about what happens in terms of health insurance. If you have less income because you're not able to work, and you may have limitations in your ability to gain health insurance, you may be more likely to forego or delay health care because of cost. And this is a really increasingly important problem for cancer survivors. And then in addition, we have this trend. I'm sure many of you are familiar with it, but I think it's really important to point out that in the 60s, many of our cancer drugs at list price, when they were just released approved by the FDA, the cost was about $100 a month. And now we have this exponential increase. We're talking more like $25,000 a month. And this graph only goes through 2010. We have a lot more immunotherapy and targeted agents that have recently been approved for numbers in excess of that. So when you think about someone who maybe has a bill for cancer drugs of $100,000 a year, and potentially they have a 30% or a 40% coinsurance rate, that is $30,000 out of pocket or $40,000 out of pocket, and that is just for the drugs. That doesn't include supportive agents that allow them to continue getting the drugs. It does not include additional scans, hospitalizations, or a lot of the other services that cancer survivors need. So in this next slide, it's a really creative and compelling study. Colleagues Scott Ramsey and his team at the Hutch in Washington State looked at rates of bankruptcy in individuals with a cancer diagnosis and similar individuals that did not have a cancer diagnosis. So in this graph, the red, sorry about that. The red reflects the cancer survivors, and the blue is individuals without a cancer history. And these are chosen to be really similar in terms of age, where they live, socioeconomic status. So really the main thing that we're looking at that's different is a cancer history. And you can see that every year there's a higher risk of bankruptcy in the cancer survivors compared to the individuals without cancer. This spike right here is a legislative change in terms of how bankruptcy laws were in effect, but you still see this higher rate in cancer survivors. So what their team did next, I think, was particularly interesting. They then looked at only the cancer survivors, linked those data to mortality data, and looked to see what the risk would be of having filed for bankruptcy on mortality. And they found that bankruptcy was associated with increased mortality risk, and this is a hazard ratio of almost 2 in adjusted analyses. And they did probably 15, 16 different types of sensitivity analyses looking at different factors they thought might be related to this association, including things like restricting only to early stage disease at diagnosis. So again, these are only cancer patients. These are, and we're looking at the risk of dying early because you filed for bankruptcy. Now, one of the concerns about this study is we really don't know the mechanism. How is this happening that people who file for bankruptcy have a higher risk of mortality? There's a couple proposed mechanisms. One would be a lower quality of life or overall well-being. Things like if people are having trouble paying for their rent or having food insecurity, things that can affect quality of life, this can be a problem. Increased stress or distress, being worried about medical bills, and also importantly, decreased treatment adherence or access to care because of having financial hardship. So some colleagues and I were thinking in advance, and also sort of coincident with some of this other work, when we see some of these studies about medical financial hardship, what is it that we are actually measuring, or what do we think we are measuring? And we adapted a framework that was building on the disparities literature, and we identified 3 main categories of financial hardship. The first would be medical hardship. So those are things like having trouble paying medical bills or having medical debt. Psychological, those would be worry about the bills. And then behavioral, where because of either material hardship, you have a lot of debt, because you're worried, or some other reason, you then delay or forgo care. And so those are pretty consistent with the 3 main hypothesized mechanisms for a higher risk of mortality following a bankruptcy filing. So what I'm going to try and do is add some national data to some of the comments that Mary Scroggins made earlier about financial hardship. So I'm going to talk about 2 surveys, one of them conducted in 3 settings. So the first survey is the Medical Expenditure Panel Survey, Experiences with Cancer Hardship. And in that survey, it's something we started in 2010. And at that time, we thought, oh, we will just find a well-validated couple of questions about financial hardship, and we'll include this in the survey. And unfortunately, there weren't any. We did include a number of questions related to the concepts of material and psychological hardship. And this survey was fielded in 3 settings. The first was a nationally representative household survey, so it was the MEPS sample. The second was an online survey by the LIVESTRONG Foundation. And so that was actually a much bigger population than the nationally representative survey. And then the third was a registry identified group of breast, colorectal, lung, melanoma, or prostate cancer survivors. And this was a survey in 3 health plans. So these individuals were identified based on registry records, whereas the other 2 settings was based on self-report. And then the second data source is the National Health Interview Survey, and I'm gonna show you some estimates about behavioral hardship. Okay, so these are estimates from the MEPS Experiences with Cancer survey, and I want to orient you quickly to this slide. I have the estimates of each of these categories in this column. So things like having to borrow money or going into debt, 7% of adult cancer survivors mentioned that they had to borrow money or go into debt. And I should have said this is a household survey. So what this means is that these are people who are mostly long-term cancer survivors. So the majority of people in this sample had cancer more than 5 years ago. So this is a long-term lasting effect. About 2% filed for bankruptcy. 12% said they were unable to cover the share of their costs of care. 9% made other financial sacrifices, and overall about 20% had any aspect of material hardship. And about 23% said they had some aspect, they were worried about their finances, or they were worried about paying for their care. So that's the psychological hardship. In this next slide, I'm showing you these 2 aspects, material and psychological financial hardship. One of the questions we had was, is it that people have both? Do they have one, or do they have neither? And so what I want to first point out is this red here is both psychological and material hardship. So these are people who are having trouble paying bills, and they're also very worried or distressed. You'll notice that it's about twice as large for the population age 18 to 64 compared to those 65 and over. And the reason we stratified by those 2 age groups is to reflect differences in employment and also health insurance in those 2 age groups. You'll also notice, though, that there's a group that have material financial hardship only. So they're having trouble paying bills, but they're not worried. And then there's another group that has psychological hardship only. So they're worried, but they're not having trouble paying bills. So overall, about 40% of cancer survivors under the age of 65 report some form of financial hardship compared to about 20% in the population 65 and over. This next slide also stratifies by age group, 18 to 64 and 65 and over, and quick orientation again. This is the ages 18 to 64, and this is stratified by type of health insurance. One of the questions we had was, is financial hardship associated with health insurance? We think it is, but we'd like to see. So here I'm showing you any type of financial hardship. For those who have private health insurance, about 25% report having medical financial hardship. Closer to 35, 40% public or uninsured. And this difference is significant. When we look at the population age 65 and over, not much variation by health insurance type, but I do want to point out that about 13% of those people say they are having trouble paying their medical bills. Findings are similar when we looked at psychological hardship. So again, we see much higher rates of hardship among the uninsured. Here, the people with public or any private are more similar. And again, no variation for the population age 65 and over, but still about 13% are worried about paying their medical bills. In this next slide, this is from a study led by Larissa Nekledop, and this is looking at material hardship in adult survivors, and this is based on individuals identified based on specific cancer diagnosis. And the main point I want to make here is that you see a big difference for those with lung cancer compared to individuals with melanoma or prostate cancer. So you see variation in financial hardship based on cancer site. It's something important as we're thinking about what to do next. This next set of slides are from a study using the same survey, but it's fielded on an online survey from, done by the LiveStrong Foundation. And so individuals were contacted. One of the disadvantages of this survey is we do not have a denominator, so we can't say that it's nationally representative. However, we have a really large convenient sample of 6,000 people. And so what we can do is look at some of these questions in a little bit more detail in this very large sample. So what we did here is we looked overall, and then we looked at individuals who had debt. And the main point I want to make here, did it again. The main point I want to make here is for those who have debt, they're almost twice as likely to make other sacrifices, to have filed for bankruptcy, and they're also much more likely to be worried about medical bills. Okay, this next slide shows out-of-pocket spending among cancer survivors who reported borrowing money or having debt. I want to orient you quickly and show different categories of what they might be spending on. Medical expenses, almost 100%. Not surprisingly, 100% are spending on medical expenses, but we also see that 60% are spending money on transportation, and another 25% to 30% are spending money on lodging, and then 10% on childcare and home and respite care. And so when we're thinking about out-of-pocket spending directly related to medical care, it's not just about the medical care itself, it's everything that allows that patient and their caregiver to get to that care. This next slide shows cancer history in behavioral financial hardship. And this, again, is in the younger population, ages 18 to 64, but it uses data from another household survey, the National Health Interview Survey. The green reflects individuals that are previously diagnosed with cancer. So this is people at least 2 years after a diagnosis. The red is recently diagnosed, so these are people within 2 years of a diagnosis, and the blue are individuals that are similar but just don't have a cancer history. So they're the same age, same socioeconomic status, they have the same type of health insurance. They also have other, same geographic region. We also adjusted for things like number of comorbid conditions. And what you see here is Individuals with a cancer history are much more likely to say that they delayed filling a prescription because of cost, they took less medication because of cost, and they skipped medication doses because of costs than their counterparts without a cancer history. So I want to summarize quickly what I've been showing you so far. Different aspects of financial hardship are material, psychological, and behavioral. And when we think about these different aspects, it's really critical because if we want to intervene in some point to improve outcomes for patients and survivors, we really need to understand that mechanism of what's leading to this financial hardship. What is the mechanism we want to address? So for example, if someone is having trouble paying bills, distress counseling may not be as helpful in alleviating that person's burden. Where if someone is not getting medication that they need because of cost, that might be a very different intervention. I also showed you that financial hardship is relatively common, even many years following cancer diagnosis. I showed you that 40% of individuals ages 18 to 64 report having some form of financial hardship, and 20% of those 65 and over, those who have Medicare coverage for the most part, are having some form of financial hardship. I also showed you that out-of-pocket spending is for much more than just medical care. It included things like transportation and childcare and lodging, and that risk factors, there are a number of risk factors, including things like younger age, being uninsured, in some cases having private insurance, having a more recent cancer diagnosis, and also it depends to some extent on cancer site. We saw higher rates of financial hardship among individuals with a lung cancer diagnosis. A number of other studies have been conducted, although this is definitely a rapidly growing area. We see that individuals who are younger, female, minority race or ethnicity, having a more recent diagnosis or a more recent treatment, having lower household income or any other measure of socioeconomic status, and importantly, as Kathy noted, the importance of employment if they're unemployed or they changed employment because of cancer. All of these factors have been associated with higher rates of financial hardship. A couple quick comments. I mentioned that this is an emerging area, but there is an increasing research to develop the evidence base for informing interventions to reduce hardship. So we're seeing a lot more measure development. Some of the measures don't necessarily make distinctions about different aspects of hardship. Maybe something coming up with a score may not be as easy to use in terms of identifying an intervention. There's also a lot more primary data collection. So I hear pretty routinely from people who may have seen the MEPS survey, and they say, hey, can I have a copy of that? I'm doing primary data collection. Can I use that survey? And I say, how can I help you use that survey? It's publicly available because it's part of it's publicly available. So there's this opportunity to be doing primary data collection and then compare in a sample to a nationally representative sample. So that can be a really helpful thing to do. There's also increasingly other national surveys. So I'm mentioning here the 2016-2017 MEPS Experiences with Cancer, which is in the field, has a number of the same questions and also some additional questions. But there are some other surveys, things like the Behavioral Risk Factor survey also has questions about household instability, food insecurity, things like that. So increasingly we're getting more measures in national surveys. Importantly, the NCI Physician Data Query also has a financial toxicity summary of evidence. So this is something available for both providers and for patients. It is a continually updated summary of available evidence related to financial hardship. And then there is increasingly resources available for coordination for individuals who may be experiencing financial hardship, things like financial navigators, I think others have mentioned, something that we're increasingly seeing, and then also special programs. Like I know there's a program, a cancer care equity program, helping patients address financial hardship. So I see my yellow light, and I want to end on time. So thank you very much. And I'm looking forward to a really interesting discussion in a couple minutes, so thank you.